Next speaker.
Next speaker is Dr. Pranita Sahay.
Can you upload the presentation, please?
She is not here.
It's a recorded presentation.
Now, Dr. Pranita is going to present on artificial intelligence and keratoconus, ectasia, and other corneal diseases. She is MBBS gold medalist PMCH, MD AIMS, DNB, ICOFRCS. Senior residency in RP Center, AIMS, Delhi, ex-assistant professor, LHM, DEC, Delhi, and ex-assistant professor, UCMS, Delhi, and consultant corneal services in CFS, Delhi. She has, with her index publication, 82. Now, she is not here. She will present her presentation.
Present on the topic of artificial intelligence in keratoconus and other corneal diseases. I have no financial disclosures. So as the discussion has been going on, majority of the work in artificial intelligence and ophthalmology is pertaining to retinal diseases. However, the upcoming studies show that artificial intelligence is being explored in areas of corneal diseases, cataract, and glaucoma. In cornea, the most common areas wherein artificial intelligence is being applied to include keratoconus, refractive screening, infectious keratitis, dry eye disease, tubes dystrophy, pterygium, and corneal transplantation. Keratoconus and refractive screening are two of the most hot topics and most explored areas for artificial intelligence in cornea. Pentacam and OBSCAN2 are the two conventional tests that are used for identification of keratoconus. The results of these tests are extremely sensitive and are highly predictable. However, the reports of these tests show a vast data set and require an experienced eye care professional for its analysis. So why is AI important in keratoconus? Form frosty keratoconus identification and keratoconus progression are two most important areas in the field of keratoconus that require early detection with close monitoring and prompt treatment with corneal cross-linking to preserve vision and result in better visual outcomes. However, there's a lot of confusion while assessing the Pentacam or OBSCAN reports in FFKC identification and assessing serial reports for keratoconus progression. That is where artificial intelligence becomes handy. The data that is pre-fed onto the algorithms of AI for developing softwares for keratoconus identification include refraction, imaging data of keratometry, elevation, tachymetry, heat maps, and also ocular biomechanics. The various algorithms that are used are described in this table. The most common ones are the convolutional neural networks and random forests that are used in keratoconus identification. The Pentacam images are most commonly fed onto these algorithms, and ultimately these algorithms are able to identify normal versus early keratoconus and advanced keratoconus. So keratoconus identification, staging, and progression all can be done with the help of artificial intelligence. Also, prediction of visual and refractive outcomes of treatment like intracorneal ring segments has also been described with artificial intelligence. Overall, a high sensitivity and specificity has been reported for keratoconus detection with AI. Also, some studies have compared AI with non-AI indices, that is the KISA and the keratoconus index, and reported similar outcomes between the two. Keratoscreen model is one of the models that has been developed to screen early keratoconus and other ectasias using Zernick polynomial data from the corneal topography and tomography. It uses an artificial neural network. KEDOC, that is the keratoconus early detection and of progression model, uses serial Pentacam reports with a deep learning neural network algorithm for detecting keratoconus progression. Manual detection of progression versus image-based detection of progression was compared in this study by Reddy et al., who found that identification of progression was earlier and CTVA was more stable in AI-based detection of keratoconus progression and interventions. An ongoing project which is being developed is the smartphone-based keratograph for identification of keratoconus. So this is like a cost-effective alternative to the expensive equipments of Pentacam and OpScan, wherein the smartphone has been coupled with the Placido disc-based imaging, and the software is extremely user-friendly and does not require a healthcare professional for capturing images or analyzing the results. Hence, can be used for community-based surveys or screening for keratoconus. Keratoconus severity classification has also been studied by various authors using artificial intelligence. Refractive surgery is one of the most common procedures performed in ophthalmology after cataract these days. And with innumerable patients turning up for refractive surgery, it is very essential to screen these patients well to avoid long-term complications. So AI in refractive surgery helps in prognosticating visual outcome and also calculating the risk of post-LASIK ectasia, which is extremely pertinent in these cases. Pentacam Random Forest Index is one of the parameters that has been developed with artificial intelligence, which when compared with BAD, that is the Bell-Ambrosio display, that is the conventional test for identifying risk of post-LASIK ectasia, it was found that PRFI was way better than BAD in predicting post-LASIK ectasia. Also, machine learning model was compared with conventional methods of person tissue ablation and Randleman ectasia risk scoring, and it was found that the machine learning model was better. It was correctly able to reclassify patients of post-LASIK ectasia as ectasia risk group on the basis of pre-operative data that was available and fed into these algorithms. Now, AI has also been explored in infectious keratitis, where these algorithms have been correctly been able to identify corneal ulcer and also the type of corneal ulcer. It was observed that the diagnosis with these AI-based algorithms was found to be better when compared to clinicians. Also, the specificity of these algorithms for fungal keratitis was way higher when compared to bacterial corneal ulcers. It not only identifies corneal ulcers, but also assesses the disease severity based on the measurement and assessment of size of the corneal ulcer. And because it is able to assess the size of the corneal ulcer, it can also assess the response to therapy, medical therapy that is being given to patients by assessing the serial clinical photograph results. Now, this is a study by Patel et al. Where they reported the measurement or assessment of size of the corneal ulcer with artificial intelligence. You can see that the ulcer was monitored serially with artificial intelligence. And in fungal keratitis, it has also been put to use for assessment of results of confocal microscopy. As you're aware, the confocal microscopy results are provided in multiple section images, and each image needs to be analyzed closely to give appropriate and good results. An automatic detection of these sections, especially when detecting hyphae in cases of fungal keratitis, can be extremely time-saving and can reduce the workload of the healthcare workers. Now, various other corneal pathologies where AI is being explored are dry eye disease, wherein ASOCT images have been used to assess the thickness of the tear film. Frontal eye videos have been used to assess the tear breakup time. Tear film lipid layer interference images have been used to assess the lipid layer breakup patterns to compare evaporative to assess and diagnose evaporative dry eye when compared to aqueous deficient dry eye. In Fuchs dystrophy, deep learning algorithms have been used to identify early Fuchs dystrophy where there is only descemet endothelium complex thickening without any evidence of corneal edema. In pterygium, AI has been used to identify pterygium, its location, and also its size. Pterygium net is one of the algorithms that has been put to use for this assessment of pterygium. Some authors have also reported use of AI in assessing post-DMEC graft detachment, wherein the artificial intelligence algorithm automatically assesses the ASOCT images and identifies even minor or shallow detachments of the DMEC graft. So these are the areas where AI has been used in corneal diseases. However, the major limitation is that there are different algorithms and softwares for assessment of each of these diseases. A single software that can assess multiple diseases altogether and in the same software is something which can be most beneficial to the clinicians. A similar software was developed by Elsevier et al., where a single image of ASOCT was assessed by these deep learning neural network algorithms and identified dry eye disease, Fuchs dystrophy, and keratoconus, all three with the help of single ASOCT image. So development and refinement of such softwares in future is something which will be most promising for clinicians to use in daily practice. Thank you.
A good presentation by Dr. Pranita.